Oh, I know that music. We'll be hearing a lot of that on one of our favorite TV shows in the coming weeks. Want to thank everybody for joining us this morning. This is a segment of the program we call Better Health with Tripp Family Medicine on News Radio 1310 KLIX and newsradio1310.com. And my role in the next half hour is just to maybe answer any telephone calls or uh, just to make sure that the two guests here are comfortable. Our telephone number, I should point out, 7360300. First of all, I was expecting Russell Singleton, and so I apologize to Jeremy Daly because I mentioned Russell on the air at about 8:15. But it's just a same office, same job description, and you can do just as well as he can, obviously, in the sense that you've got the exact same training, and I'm sure that Shelley laid down the law before you ever even got out of the building.
Oh, that's what always happens, so I'm used to that.
And you brought along a guest today.
I did. I brought Brett Thomas with me from Magic Valley Insurance. So we're pretty excited today to talk about some of the um, I think real hot topics as far as insurance goes and a lot of questions that people have. Hopefully we can answer as far as, well, how do they get health insurance if they haven't gone through the healthcare exchange before, and what are the kind of the frequently asked questions about health insurance nowadays.
I know that it's not even just the exchange issue, but we get a note here usually in early November. It was a few weeks ago, and we're asked if we would like to make any changes in our plans, and then you can make selections. If you don't, it just it carries over to the following year.
Hmm.
But I would assume anybody who's either getting insurance through an employer or on an exchange has a lot of these choices and options to make come November every year.
Yeah, I would definitely say so, and I think that we sometimes just go with what we have and we don't make changes because we're not sure. We don't have all the information that we need, and so it's nice to have people like the staff at Magic Valley Insurance who really know the ins and outs of insurance and what questions you really the questions that maybe you didn't even know you had about your insurance plans, they can answer for you. So
But I was going to say, that's an interesting point to be made because a lot of times people, I'm sure, come in and since they don't know what to ask, you have to actually ask the questions to find out what it is their needs are or what their wants might be.
Absolutely. Yeah. I mean, that's part of what we do is helping, um, you know, uh, finding plans that are tailored to your needs, and the key to doing that is asking the right questions to find out what your needs are. Um, we're getting more and more now with a few years of Obamacare behind us that people are a little more aware of what's going on, and we don't have to do as much of that. But certainly within the past few years, helping people understand Obamacare and its intricacies and the little nuances, and asking the right questions so that people understand, um, what's best for their family.
And
That's our
the,
job.
and people I think who aren't familiar with it because they haven't seen it or used it, there are multiple level plans even in what we call the Affordable Care Act or Obamacare.
Correct. Yeah. I mean, and that was designed by the federal government to hopefully make shopping easier for the individual consumer. They have metal tiers of bronze, silver, and gold plans. We had platinum for a year here in Idaho, and then they took that away because it got overutilized, I think. But yeah, just those tiers kind of help people um, tailor their insurance to their needs a little bit easier. You have your bronze, which are your lower premiums, but typically your higher deductibles and higher out of pockets. Your silvers are kind of your mid range, and then your gold is going to cost you more each month, but you've got typically lower deductibles, and so
Is it confusing? I mean, to a lot of people. I mean, that's a question I guess that a lot of people are almost intimidated when they have to sit down and start going through all of this, especially if it's beyond the frame of your daily reference.
yeah, and that's the thing with I think with anything like that. It's like your taxes. You deal with it once a year, and so you're not swimming in those waters every single day like we are. And so when it comes around, you sometimes even forget what you had to do last year, and I think those things that we don't do consistently sometimes can be intimidating. And that's I think the to speak to the benefit of using a broker, is that we're doing that every day, just like your accountant. That we're dealing with these issues on a consistent basis. We know the ins and outs. We're sitting down with insurance carriers the entire month of September to go through all these plan changes and network changes and so yeah, I mean those things can be intimidating. You get these notices of change in the mail, and it's hard to even sometimes make sense of what's changing in your plan,
And it's
and
always changing.
it is always changing. Particularly, I mean, yeah, and certainly with I think we've seen even more of that with Obamacare. That the way plans, rates, and networks are changing have been more significant over the past few years than even we've seen in the past.
And
So
unlike taxes, there's no turbo health.
right,
So
exactly.
not yet. Maybe somebody out there is already working on a program. Well, we need to take a short break, but we've got an extended segment coming up on the program this morning. It's Better Health with Tripp Family Medicine. And if you have a question or comment about health insurance and might be among that group that has to make a lot of hard choices, feel free to give us a telephone call on the other side of the break. It's 32 at 840. And you're listening to I'm going to call it 1310 KLIX and News Radio 1310.com, which means if you're out of town, you can hear us anywhere all over the world on the web by clicking on the Listen Live icon. Talking a little bit about your health this morning on Better Health with Tripp Family Medicine. Brett Thompson is here, and he's delving into some details on insurance coverage and choices, and sometimes some very difficult choices people may have. Well, if not difficult, confusing might be a better description. And of course, Jeremy Dowley from Tripp Family Medicine. And, the one thing that I've always found is once I get through that initial period, and I have to admit, over the last couple of years, all I've simply done is continued the insurance from the year before because I haven't had any changes. But the changes people worry about if you do have a job change or maybe you have a child or there's any number of things, the status of your life, gets altered. It might be a good idea just to review the plan, at least take a look at it every year in some depth so you don't have any curveballs thrown at you the following year.
Yeah, definitely. One thing that I see a lot in the clinic is that people will come in and, I don't deal a lot with the insurance side of things. I prefer to deal with the clinical side of things. Um, those are complexities that I can deal with. But, the biggest complaint that I hear from people is they complain about the high deductible plans that they thought, well, I didn't anticipate having this health problem. They come in after being diagnosed with something and they were seemingly healthy when they signed up for the plan and they find themselves in a position where their high deductible plan takes a while to meet. So they're paying out of pocket for all of their health care for a long time. And so it is a difficult thing. And sometimes you can't foresee changes that are going to happen in your health. But it's important, I think, to be realistic. I mean, a lot of people they want to say, well, I want to pay the least amount that I can every month for these premiums, and they end up with a high deductible plan, like Brett was saying, and which for some people works great, especially if they only visit um, the doctor's office every now and then, or they have no chronic health issues, then it's not a problem. But for the people who have chronic health issues or prescriptions that need to be filled on a regular basis, studies that need to be done, some people have to have regular um, imaging done, like MRIs and CT scans and things like that. And if they're paying out of pocket, if they have a high deductible plan, let's say a $10,000 plan, which isn't out of the question these days, they're paying a significant amount of money more than just their regular premium every month for that plan. And so, it's really a balancing act figuring out, well, is $300 more a month or whatever the case may be, rather than having to meet a $10,000 deductible, maybe a $3,000 deductible at the end of the year. It makes a big difference.
I'm jumping back about 30 years, but I was on my dad's plan until I was 25, and I was already out of the house, and he was a government worker, so I had that benefit. But when I turned 25, obviously I had to go my own way and find something, and I ended up taking one of those high deductible plans because you're thinking I'm 25. If I get hit by a train, that's one thing, but the odds of that probably aren't very high. But I wasn't making a lot of money, so I chose that low payment. But then I remember my dad pulling me aside and said, "What happens if you break a leg?" Now, I didn't think about that at the time until he brought this up. But this is something that these are questions that I'm sure you have to ask people, and they get bandied about in quite a bit. It's a choice they have to make, and they have to be aware that all right, it may be improbable, but it can happen.
You bet. And, speaking years ago, um, the real difference is that if you had a chronic illness that you got diagnosed with, you couldn't make a plan change. You were kind of stuck with whatever insurance you chose. Well, the Affordable Care Act has changed that, where you can be on a high deductible, low premium plan through the year, and let's say you get diagnosed with something. Well, now during this open enrollment period that we're in, you can change to a better deductible, a different plan, and they're required by law to cover that pre-existing condition. So that environment has changed a lot too, where people can still make plan choices after the fact. Where just a few years ago that wasn't the case. If you got ill on a plan, you typically had to stay put um, on that plan because an insurance carrier wasn't going to pick you up and cover that pre-existing condition. So there are a lot of uh, differences with the Affordable Care Act in even just during this open enrollment making plan choices that are not the way they were even 5 years ago. So,
There's also, and maybe this is a topic we don't want to delve into because you're not endorsing anything here from a political perspective. You're just talking about the realities.
sure.
But we could obviously see some changes coming, I'm sure, as soon as late January, where people are going to be talking about making the changes wouldn't be immediate. They'd be obviously phased in or gradual. But there are going to be a lot of people coming into both of your offices, I'm sure, if these things start happening, and they're going to be saying, help me out. What's going on?
Yeah, in fact, Bill, we've already had we were surprised at how many calls we received November 9th, the day after the election, of people wondering if they still needed to buy insurance next year. And so I know it's on people's minds. There are some out there that are hopeful that there might be a repeal of the Affordable Care Act. There are others that are hopeful that it stays in place so they can keep their tax credit and their premiums low. And there's no question that we will probably see some change come about as a result of this new administration. But as you mentioned, it's not going to happen overnight. It doesn't. They don't even take office till January 28th. 2017 is really set. I mean, you're not going to see. You I, I don't think an administration can come in and make plan changes in a current plan year. Uh, so the earliest I think you'd see anything is 2018, and even then, you have carriers they have to submit their rates to the Department of Insurance by March. So you may even be hard pressed to find changes happening for 2018, really. And I think you'll see rather than this is just my opinion, but rather than just a blanket repeal, I think you're going to see more piecemeal changes happening over time. Of pieces of the Affordable Care Act will be changed, and it still has to run through Senate parliamentary procedure. So in some of those changes, you have to have some bipartisan support for for some of that to happen. So
Our debates on this have been going on since I think that we had HMOs introduced in the early 1970s. And I remember watching a video that was probably made 6 or 7 years ago he was then in Congress, by Ron Paul. And he was a doctor, of course, so he probably had a little bit more expertise than a lot of other people in this. And he was making a call to get us back to the old indemnity plans. But I have a doubt in my mind we'll ever see anything like that crop up again.
yeah, I think you're. And we were actually we're seeing as far as HMO PPO design, we're seeing even the PPO being almost a thing of the past. We're not we're seeing narrowing of networks among carriers, trying to control costs, controlling where people are going. That's one of our big conversation pieces this year. Is we've had two of our major carriers in the state that have limited their networks significantly. So your ability anymore to kind of choose where you want to go, um, to go out of state and to choose your hospital and your provider, and we're not seeing as much of that anymore. And these insurance carriers are trying to manage their costs more aggressively than they've had to in the past, I think.
I know every couple of weeks I read something about this. I get a daily email from the Heritage Foundation, and it tracks what's going on with the exchanges in various states. And in some states, they've seen providers literally pull out of the state and decide not to do business there. It seems that Idaho doesn't have some of the troubles that maybe Tennessee has. Some states are in worse shape than others. But is it going to make things even more? This when we talk about people having questions, it's becoming more and more difficult for people. Are we limiting the choices that they have through all of this?
Absolutely. I mean, I think we have, as you mentioned, we've been very fortunate in Idaho. We have some insurance carriers here that are very committed to the individual market and trying to offer plans that help the consumer. Uh, there are some states that are, yeah, in pretty dire situations in the insurance world on the individual market and through the exchange. Um, but we have seen certainly the number of plans offered 2017 is significantly lower than it was um, uh, in 2016. In some ways, that's a good thing. It makes the plan selection easier. Sometimes when you have too wide a variety, it makes it hard to make a choice and know what you're trying to find. Um, but certainly we've talked in our office at length about whether or not these 30% rate increases that we've seen this year, that is not a sustainable rate of increase in rates. That if we don't see, something's got to give, I guess, is these insurance carriers have not raised rates to line their pockets. They're doing it because the utilization has been through the roof, and they're um, uh, trying to still play in the market, and they want to still be able to provide options for people. But that's um, yeah, we could as a state be facing those same challenges down the road, no
You,
question.
you think about a lot of this, and I've just you mentioned choices. There can't be too many. There's a couple of people who've written stories about this in some of the medical journals. That part of the problem we have currently is we have too many choices as people when we go shopping for anything, and you get confused. Yeah, it becomes very difficult. But I would think that at some point, no matter what happens, there's going to be a settling, and that we're going to reach an equilibrium, and then the changes will stop. I mean, at least slow down enough where people don't feel whipsawed every year when this comes around.
Well, that may happen. We were kind of talking about that earlier, but at some point, if the rates continue to increase, then I think we'll see maybe something more than a settling, a big change that has to happen to allow people, the general consumer, to be able to afford health insurance because, like Brett said, at the rate that things are going, it's not really sustainable. So, uh, and the usage will continue to be there. I mean, I don't think we're going to see a decrease in usage. From a healthcare perspective, we see chronic diseases increase. I mean, obesity, hypertension, hyperlipidemia, uh, diabetes, all these things that really need to be managed on a regular basis. Those diseases are not decreasing. Healthcare is not going to become less utilized in the future. In fact, I think it's going to be more utilized in the future, especially as people start to recognize that maybe they have the signs and symptoms of certain disease processes, with social media and news and everything like that, giving them access to information, and so they come in more often to be evaluated. So it's going to be I think it's going to reach a tipping point where, and that's not really the topic of discussion today necessarily, but I think it's important to.
We have a caller with
Oh,
us and want to say, caller, welcome to the program. You're on Better Health with Tripp Family Medicine at 854. Go ahead.
Good morning, gentlemen. I know this is a very, very uh, divisive topic
certainly.
because health insurance is supposed to be insurance. It's insurer and insuree making a calculated judgment, and it's turned into health care, not insurance. Everybody needs to get rid of that word. The day it got forced down our throats, it's no longer insurance. It's something you have to have. But the problem is the insurance companies are also paying out enormous amounts of baloney. I have a CPAP machine. I've had it for over a year. Insurance paying on it. Didn't realize what was going on because insurance taking care of it. My insurance renews. I have a $700 deductible. I'm getting bills every month that by the time I get my deductible done, I could have bought the machine twice over. So I called the company that was providing me the machine, told me that they were a bunch of crooks, bought the machine outright, which is going to hurt me on my deductible. But I just can't see the cheating that goes on through the insurance company that causes these kind of inflation problems.
Well, I guess is there an answer to that?
Well, yeah, I think we can all sympathize with what you feel like you're paying out and wondering what you're getting for that monthly premium sometimes. I do think that there's been an unfair stigma attached to health insurance carriers as being as being crooks, and we've sat in meetings with every carrier in the state. I know a lot of these people personally. They have taken enormous losses on the individual market, partly because they've been required by the federal government. They're feeling a lot of the same frustration you're feeling in being required to have health insurance. They've been required by the federal government to cover those with pre-existing conditions. That's contrary, really, as the caller mentioned. That's not really the way insurance works. That's the equivalent of a on your home, being able to call your State Farm or your Allstate agent while your house is burning and tell them I need insurance because my house is on fire. Insurance does not, by nature, work that way. But that's the way we're trying to make it work. And I don't want to get in the politics of it, but
Right.
but insurance carriers, I can tell you, are not lining their pockets through this process. It's been harmful for them as it is for the consumer.
Well, before we wrap up, we've got about 60 seconds. What's your contact information?
Yeah, you can find us online at magicvalleyinsurance.com. Our office line is 733-2528.
And of course, Jeremy, the contact information at Tripp Family Medicine.
Yeah, you can find us at 1411 Fillmore in front of the post office, and our phone number is 933-4400. And we are accepting new patients, and we're happy to take care of you. So we're always looking for new patients and people to see and take care of.
And the new website is up too.
It is at trippfamilymedicine.com. Go check it out.
Hey, coming up in just a few minutes, we've got news first from Fox at 9 o'clock. But we're going to be talking, I believe, model railroading in the next hour and a big open house taking place at the Twin Falls County Fairgrounds.